Hey, everybody. Welcome to another Chai with Charuba. Happy Thursday. I have my coffee here and looking forward to talking to you guys today about some cancer screening stuff and kind of the basic health uh, screening, cancer screening. When do you need to do something a little bit extra? So we're not going to do general Q&A today. We're going to really talk about this, and then we'll take some questions right after that. Feel free to post in the chat as well as you get questions, and look forward to answering them. So wherever you are in the world, grab your chai, take a seat, and join me for this conversation about cancer screening. And if you have a friend who would think that this is useful, please tag them as well so they can join in. Or maybe you're watching the replay much later. Please tag a friend. Okay, so I just had my mammogram this morning, which, as you know, is a breast cancer screening test. And it got me thinking about just other screenings that, we do. And I wanted to talk to you about it. And another thing that prompted me was, I this week I lost one of my best friends very suddenly. Healthy guy, just out of nowhere, and it was very, very tragic. And it reminded me that there are so few things that we can control in life, right? We think we have a lot of control, but there are circumstances that are external to us. There are decisions that other people make that we don't have control over. There's just a lot that we can't control. But there are few things that we can't control, especially when it comes to our health. And I know many people have health anxiety, like, oh my gosh, there's this lump. What does that mean? Oh, I'm having spotting. Do I have cancer? Right? Like your mind immediately goes to the worst place. And again, we can't control all the things, but there are three or four things that we can do proactively when it comes to our health, other than, exercising and eating well and all of that. But I want to go over some of the tests that I talk to my patients about on a daily basis. So we'll talk about that, and we'll also talk about when you need to, do something maybe a little bit more than just the average. So I have just three simple points, and then we'll take some questions. The first is, what screening, do we recommend? So we recommend a yearly mammogram, which is imaging for your breasts, and this looks for calcifications, masses, and essentially is a screening for breast cancer. Okay, so mammogram yearly. The American College of OBGYN suggests every single year. Now, some of your primary care doctor may say every other year. Some people may say, oh, you can start at 50, but really the recommendation from the OBGYNs are every single year starting at 40, because the incidence of breast cancer in the US is 12%. Okay, so it's a lot and it's high. And we want to make sure that we are, taking care of this and doing our best to catch it early. So, breast cancer screening every year. Number two is, cervical cancer screening. So cervical cancer screening is done through a PAP, and a PAP is really every 3 to 5 years. Okay, so this is not a yearly thing. Cervical cancer does not appear overnight. It's caused by human papillomavirus. I have tons of videos on this, but cervical cancer is extremely slow growing. So that's why the screening is not every year for that. It used to be every year, like 15 years ago, but it's really every 3 to 5 years now. So make sure you're talking to a gynecologist or your primary care doctor to make sure you're doing that. And then colonoscopy, right? So colonoscopy used to be at 50 every 10 years, and now it is starting at age 45 every 10 years. So now if you've got polyps or you got a little tumor, you may have to come back every 3 to 5 years. If you have a family history, it may be every 5 years. But for the average patient, it is every 10 years. Now, there are some other tests that are done, like Cologuard, or fecal occult blood testing, which is where you send these stool samples and like these cards that get mailed out, and then they tell you if there's anything to be concerned about. But these tests actually look for blood in your stool. And often, when there's already bleeding, right, that means a polyp has already formed. If there's precancer, early cancer, these things have already started to show up. A colonoscopy is a see and treat, right? So you go in, if they see any polyps, they remove it at the same time. They can biopsy things. So this is why that is the gold standard. And we know that colon cancer is coming up earlier and earlier um, these days. And so I just had a patient, who had colon cancer in her 30s. And so we really want to be vigilant and get our screening. So again, it used to be 50. Now we start at 45. Okay. So cervical cancer screening, breast cancer screening, and colon cancer screening. So please make sure you're definitely, getting those on time and keeping up with those screenings, because these are a few of those things that we can actually that's actually in our control. And if something is picked up, it can be treated early. Now, for men, we also have prostate cancer screening. So, definitely talk to your doctor about that as well. Okay, so this is the basic screening. Let's move on to point number two. And now we're going to be talking about when do you need something a little bit more. And I'm really going to focus on the breast here. Because there's a lot of nuances when it comes to breast cancer screening. So the average patient will get a result that says, okay, nothing found, repeat mammogram in 1 year. Sometimes it'll say, oh, you have dense breasts. And this may obscure small masses. We may be missing small things, which doesn't leave you with a lot of confidence, because you're like, well, my breasts are dense. And what if there is something and we're just missing it until it becomes a problem, or a bigger problem. And so there is a recommendation, kind of loosely out there, to do an ultrasound. There are standalone ultrasound places, or you can get it through your doctor. Insurance always won't cover it, and it's not, unfortunately, a reflex next step. So if you have dense breast, you must get an ultrasound. That's ideal, but this practice is not standard around the country. My friends in the East Coast told me that, oh yeah, like as soon as they said our breasts were dense, we immediately got an ultrasound at the same time. Whereas here, a lot of my patients say they asked for an ultrasound, they were not given one, and even when I write an order, there's often pushback from insurance. So um, either get it through your doctor or just go and pay out of pocket to get one. But every year or two, you may want to also get an ultrasound to really be able to look through these densities, right? Because that gives you just a little more reassurance, that you're not missing anything. The second kind of nuance here is knowing what your lifetime risk is. So I just said before that the average incidence of breast cancer is 12%, which is 1 in 8 women in the US. But for some people, it's more than 12%, right? Your lifetime risk can be more if you've got a family history, you've got the dense breast, maybe you've had a biopsy before. So really knowing your family history and knowing your personal history and what's happened with your breast before help calculate this risk. Now, when you go for your mammogram, a lot of times they ask you to fill these questions. I had to do that this morning. How old were you when you had your first child? Any family history of breast cancer? And they kind of automatically calculate this risk for you in your report. So if you look at your report, go all the way down, and you'll see that your lifetime risk is X%. Okay. So if it's above 20, you actually have to get more screening. So you do have to get an MRI in addition. And we're seeing this very often, very frequently now. So again, if your lifetime risk is above 20%, you don't want to just do a mammogram. You actually need to do more. So I want you guys to be aware of this. Please speak to your physician about this, because more screening and early detection if you have such a high risk. So we talked about basic screening. We talked a little bit about more nuanced screening, especially for the breast. With ultrasounds and or MRI if your lifetime risk is above 20%. And lastly, I wanted to talk about genetic testing. So if you have a strong family history of any type of these cancers that I talked about, but especially breast, or maybe colon, or even uterine, or ovarian, right? Or maybe you've got one person with a couple with one of these things, maternal aunt with one, grandmother with one, parent with one, sibling with one, right? You want to get genetic testing. Okay. Genetic testing is not just BRCA, which is the BRCA gene, which is the breast and ovarian cancer gene. This is what Angelina Jolie had. And, it became really popularized at that time with more awareness around it. But there are many other genes that also put you at risk for breast, ovarian, colon cancer. So if you've got a lot of cancers in your family, or one cancer that has been going through multiple generations, you definitely want to look for genetic counseling and genetic testing to make sure that you don't carry a gene that could potentially predispose you to one of these cancers. Because if you do have the gene, then you can actually get screened, or do the appropriate procedures to minimize your risk. So I would love for all of us to just think a little more deeply about our health screening and your individual risk, and just be proactive, because that is all we can do. Going back to my first point, there's just very little we can control in life. I mean, we open our news and it's just badness everywhere on all fronts, right? And it's easy to feel depressed and hopeless about so many things. But I want us to just think about our health, and the fact that, again, we can't control everything in our health either. You could be somebody who's doing all the perfect things and then something hits you out of nowhere, right? Like, we can't control that, but there are few things we can control. And so I urge you all to, or just all to, do those few things. And then if you are at slightly increased risk, dive a little bit deeper, have a more thorough conversation with your doctor so you can get that additional step done, and or genetic testing done. So hopefully this has been helpful in just thinking about what you need to do. Doctors change so frequently these days. I have patients who tell me, oh, I went for my primary care visit and there's a new doctor. And then last year was a new doctor. And the year before that, it was another person. And so care is fragmented. And so while we think that, oh, we said all these things, it should be in my medical history and somebody will just tell me what to do, that is often not the case. So I want us all to just be more proactive and take ownership of this part. Okay. All right. I'd love to take some questions if anyone has anything on this topic. How reliable is CA-125 reading in relation to cancer? Okay, so CA-125 is a blood test that we do for looking specifically for ovarian cancer. Now, there is no screening for ovarian cancer, but the most common type of ovarian cancer does secrete that particular antigen, CA-125. And it's a tumor marker, it's a blood test, and we look for it. Now, it is a very non-specific test, which means you could be having the flu and your CA-125 will be high. You could have endometriosis and it'll be high. You could have COVID and it'll be high. In fact, I just had a patient who had high CA-125 and a small ovarian mass. And, of course, she was freaking out like, oh my goodness, I have ovarian cancer. But then it turned out when we followed it, it actually dropped down and she actually had COVID. So it's not super reliable. You really have to take the full picture into account. So often for those with a family history of ovarian cancer, we'll do the ovarian tumor marker, we'll do CA-125, plus we'll do the ultrasound to concurrently take a look. Yeah, good question. All right. Can you talk a little bit more of the wisdom study, please? Yes. So the wisdom study is a study that is looking specifically at breast cancer screening and trying to individualize screening based on each patient, right? So right now we have kind of a blanket screening recommendation. At 40, everyone does it every year. And I also referenced the fact that the primary care doctors, their college of physicians, say it's starting at 50, maybe every other year, right? So there's different schools of thought and different recommendations, and sometimes it's a little confusing. So the wisdom study, which I think we all should just enroll in. I was just talking to a patient about it, and looks at your personal risk factors, your family history, and then tells you how frequently you should be getting screened and what type of screening. So it's a little bit more personalized, and they're trying to enroll as many women as possible and have kind of a huge database so we can individualize screening a little bit more. So that's the wisdom study. Anyone can enroll, actually. This is a great question. I should actually enroll today. And we should all contribute to this knowledge. It does not mean that you need to do what they recommend, right? So for example, if they say you need a mammogram every 3 years, if that makes you uncomfortable, you don't need to follow that recommendation. But it'll be interesting to still see what they recommend based on all of the data, your family history, and your personal risk factors. Good question. What's the difference between routine screening and a personalized risk assessment? Okay, so routine screening is just the standard screening that is recommended for everybody, right? So the mammogram at 40, the colonoscopy at 45, bone density now at 65, and PAPS every 5 years or every 3 years, depending on your age and all of that. Versus personalized risk assessment is what is going on with your particular results, right? So two people may get a mammogram that they're both negative, but one has dense breast and one doesn't. One had a family history, one didn't. So really looking at your particular scenario and then figuring out what we need to do next year, or in the next few years for that condition. Are there early warning signs that women often overlook? So I don't know what cancer you're referring to, out of the ones I talked about, but for the breast, um, we do recommend, again, it depends who you talk to. Some people will say, don't do the breast exams because you freak yourself out easily. Others will say, do a breast exam so you know what's going on, which is kind of the camp that I fall into. But with the breast, definitely skin dimpling or bloody discharge from the nipple is concerning. For ovarian cancer, bloating that doesn't go away with certain foods. Like some people will say, oh, I eat something, I get bloated, and then I stop eating it and I'm fine. But this is like bloating all the time. You can't zip your pants up, you can't close the button. Um, Abnormal bleeding. So, kind of not your regular period, just sort of bleeding erratically. Postmenopausal bleeding is another big one. So these are the things to look out for. Um, and if some of this is happening, if any of this is happening, you should really talk to your physician and get the appropriate workup for it. How do lifestyle choices like diet, exercise, and stress affect cancer risk? Yes. So uh, all of these have a big effect on cancer risk, more than we thought. So we always hear, "Oh, eat well, move, exercise. Don't be so stressed." And it's hard to do all of these things, right? But stress can definitely increase inflammation in the body. Poor food, right? Processed food, overeating, you know, fatty foods, all of this make it harder for the body to digest, and it's just not as nutritious. And then lack of movement, it can also negatively affect your life. So I think I was talking to a doctor who does longevity medicine, and she was saying that you know while it's great to go and like lay in red light and all of those things for longevity, or do the cold plunges and the saunas and everything, actually diet, eating well and moving adds years to your life compared to all of these other longevity things that people are now doing, or fads that people are now doing. So I thought that was really interesting. So yes, I think trying to have some sort of mindfulness meditation practice, having a exercise routine, walking. I just read this book on longevity, and the author talks about walking 1 hour a day, plus doing cardio 5 days a week or up to 150 minutes, and then doing weights 2 to 3 times a week. That's kind of a lot if you add all of that up, right? So, but if we can squeeze whatever we can get out of that, I think that would be great. And then eating whole foods, plant-based is really recommended, and trying to manage stress as much as we can. Good question. Those are really good questions. Any others? We have a couple more minutes. I'll take any other questions we have. And if you guys found this useful, please share this with a friend, colleague, family members who need to hear it. Tag somebody. And if you're in the Bay Area and you're looking for a gynecologist, come and see us in our practice, La Miranda Gynecology and Surgery. If you're anywhere in California, you can actually do a video visit with us. And if you're anywhere else in the world and you want to talk to myself or Dr. Christensen, you can call our office and we can, do a coaching call with you. Okay. Last question. I'm 32 and my mom had breast cancer. How worried should I be and what screenings do I need? Okay. So it really depends on how old your mom was when she had breast cancer. If she had cancer early, so in her 40s or even early 50s, like premenopausal, I would really start your screening at 35 instead of waiting till 40. And you should calculate your lifetime risk. There's an online calculator for this. You could talk to your GYN. There's a couple of different calculators. You can calculate your lifetime risk and see if it's above 20%. If you've got other family members with breast or colon, or uterine cancer, then you also want to get genetic testing. But at the least, I would get a mammogram, a baseline mammogram at 35, and then find out what your lifetime risk is for breast cancer. Good question. All right, everybody. Thank you for joining me in this episode of Chai with Charuba, and we will see you next week. All right. Take care, everybody. Bye.